I welcome you all to today's session. Myself Rajita, and in this session, we are gonna start a new specialty of nursing. So this is basically an introductory session where we will be providing you the introduction regarding that is the medical surgical nursing. So basically it is an introductory session where we will be learning about the history behind the development of this particular specialty of nursing, which is named as medical surgical nursing. Now, here we'll be definitely learning about the history, the origin of medical surgical nursing, where we will be basically learning from where the concept of medical surgical nursing has been came into the practice. We will be also learning regarding how the particular specialization has been built and how the nurses would got trained into performing the nursing care in the surgical departments. We will be also learning how, with time, the medical surgical specialty of nursing has been changed. And we will be learning about the component or the concept of comprehensive nursing in today's date. We'll be learning about the trends of medical surgical nursing, also the evolution of nursing, which is definitely a worldwide phenomena. That's how in today's session we will be basically understand the concept of medical surgical nursing and how the specialty has been built and slowly it is evaluating day by day. So let's get started with the topic of the history of medical surgical nursing. So surgical nursing, which is also termed or known as medical surgical nursing, it is basically a specialty which requires the nurse to possess some set of skills in order to provide adequate and quality care to the general population or to the people who are seeking the nursing care within a clinical setup. Now, the surgical field, or we can say the medical surgical specialty, basically require the nurse to possess analytical skill, technical skill, as well as the administrative skill. The nurse here should also have organizational skill and skill to tackle people or individual, which is definitely associated with all of the other specialty of the nursing queue. So basically, if we talk about specifically about the medical surgical nursing, in this field, the nurse should definitely have adequate knowledge regarding analytics. They should definitely have huge knowledge about the technology, and also they should pose some quality where they would be able to perform a adequate administrative role. Now here next we are going to learn regarding the origin of medical surgical nursing. Now whatever is there in today's practice or in today's medical or nursing field, definitely it was not like the same before or in few years back. So we will be seeing that how the origination of the medical surgical nursing specialty or whatever the changes has been taken day by day. So let us start with the concept of origin of the medical surgical nursing. So if you see in the late 80s, that was the basic origination where in the medical field, people understood the distinctive difference between the role of a nurse who were working in medical surgical department. Majority of the hospitals in the year of 80s would definitely be consisting of three different type of wards. These wards include the medical ward, surgical ward, and the obstetrical ward. Now, each one of these different wards used to be considered as a complete different entity, and the nurses who were working in that particular field would be going under training, not a formal training though, but they used to get the informal training so that they will be having adequate clinical knowledge to perform their role and responsibility within the particular department. So, what I basically mean to say, from the year of 80s, the concept of the differentiation of medical and surgical department have came into the practice. But in those years, there were no proper formal education of nurses. The nurses would have got few clinical knowledge because of the continuous practice in the particular field so that they can effectively provide a quality care to the patient. Now, slowly from 80s, in the year or by the year 1930s, we are going to see the approach of nursing had changed, or we can say there was a huge change has been taken place in the nursing practice in the year of 1930s. We're going to see from those years there was no absolute or distinct separation between the medical and surgical nursing. So basically, in the 80s, where there are two different distinction of the practice, but in the year or by the year of 1930s, we're going to see there will be a merge of this two distinct different field of medical and surgical nursing. Now, from this year, the National League of Nursing Education began to implement a combined course where the nurses would have got a formal training for medical and surgical specialty. That's how in those years there were a combination of implementation for medical and surgical nursing. So later on we will be able to see that again the separation of this two distinct speciality of nursing has been taken place. So by the year of 1916, we're going to see there were huge changes again has been taken place in the nursing specialty. So by the year of 1916, the pendulum has been swung back where the treating of surgical patient has been completely differentiated from the medical treatment or medical patient treatment. Here, what I mean to say is, again in 1916, we are going to see that there were changes has been taken place in 1930s, where the surgical and medical nursing department has been, completely working together or was completely working together. The training for the nurses were be given in a simultaneous way, or we can say as a combined course. But during the year of 1960s, we are going to see there are a huge changes in the field of the nursing where they again started to differentiate the surgical nursing as a distinct specialty. However, it has been recognized or understood that the component of medical nursing also should be a part of surgical nursing. So basically, what I mean to say here is that definitely the knowledge of medical nursing or basic nursing care should be even be a part of surgical nursing too. But the nurses who are dealing with the patient who are undergoing the surgery or in a pre-operative or post-operative phase, definitely they should pause some extra skill in order to manage the client in their need in this critical situations. That's how the distinction of the medical and surgical nursing field has been came into the practice basically from the year of 1960s. So now if we talk about the nursing practices in the surgical field, definitely the nurses are responsible to gather all the necessary data, making the diagnosis, involve the patient to set an expected outcome or goal of a treatment, and also plan the necessary nursing interventions and implement those to the patient, and also evaluate the patient about their responses. So basically here now the surgical nurses are also responsible to follow the nursing process in order to provide effective and adequate nursing care to the patient in their need or according to the need of the patient. Second, definitely the nurses are also responsible to help the surgeons in performance or in performing the surgical technique in operation theaters. Not only that, even nowadays, the nurses are responsible to provide the care in the post-operative phase as well. So that's how the surgical nurses, or we can say the medical surgical nurses, are responsible to provide a complete, comprehensive medical care and nursing care throughout the journey where the client is seeking the medical help in a clinical setup and they're undergoing a surgery, and also the post-surgical need. Now, as we have understood that how it has been changed slowly from 80s till the 1960s, right? Now we are going to read about the era where the Academy of Medical Surgical Nursing has been developed. So we are going to see the medical surgical nursing profession began to further distinguish as a distinct entity from the year of 1991. In this year, the Academy of Medical Surgical Nursing has been developed or founded. That is the reason from this year, basically the specialty of medical surgical nursing has been considered as a very distinct specialty of the vast area of the nursing. In 1996, the Academy of Medical Surgical Nursing has been published a set of standards of nursing practice. Now, this basic guidelines from Academy of Medical Surgical Nursing has been instructed that the surgical nurse should be able to incorporate the knowledge of research or nursing research into their functions or into their performance. So I hope you got the idea that from the year of 1991, as the Academy of Medical Surgical Nursing has been developed, there was a consideration for the particular specialty of the nursing as a distinct part, right? Now, in the later session, when in 1996, the Academy of Medical Surgical Nursing has been published a set of standards. Now, this set of standards definitely instructed the nurse to incorporate the research knowledge into the practice. So that's the reason why from the year of 1996, there was a huge changes in the clinical practice of nursing. So as we have learned how the surgical and medical surgical nursing has been changed and ultimately it has been considered as a particular distinct specialty of nursing, now definitely we will be discussing here now about the today's scenario. So even in today's scenario, the surgical nursing continue its evolution. We are going to see it is now considered as a distinct specialty within the nursing with the largest group of practicing professionals. Now, according to the Academy of Medical Surgical Nursing, it has been said or noted that the nurses or the surgical nurses will be practicing in variety of settings including the hospital, emergency care facilities, home health care, skilled nursing care specialties, even in the universities. Depending on the work situation, the nurses are supposed to provide the care to the patient who are critically ill or maybe have developed with mild sign and symptoms. So I hope you understood how the medical surgical nursing field has been developed slowly, and even in today's scenario, even the nursing is being completely and continuously evaluated and changing its pattern. That's the reason many new approaches and new trends are coming into the nursing practice, which is basically, improving the quality of nursing care in the clinical setup. Now we are going to read, as we have understood that how the medical surgical nursing has been changed. Now we will be reading about the contribution of the ancient civilization to the medicine and nursing field. So if we see in early hospital, those were basically staffed with the male nurses. Now generally in those times, the male nurses would be definitely will be required to possess four definite skill or qualification. Now this particular four qualification includes the first one being the knowledge of the drugs and how to administer the drugs to the patient. So when the ancient civilization was basically changing the field of medicine and nursing, we would see the male nurses were the dominant one into the field, and where they have basically possessed four particular quality. The first among those include the knowledge of the medicine and administration. The second qualification being the promptness. So definitely here the nurses would definitely be required to adopt the promptness so that they can act upon any emergency situation in the hospital or medical care setup. The third qualification being the devotedness towards the patient. So definitely even in today's practice, we require some kind of or some amount of devotedness towards the client so that we can, administer a highest quality of care to them in order to manage their suffering. That's the reason it is considered even in today's scenario that the devotedness towards the patient is one of the most important quality of the nursing. The fourth quality is being the purity of the body and mind. Even in today's scenario, we consider that if we are not pure from our body and mindly setup, then we will be not able to provide the adequate nursing care to the patient, and we will be not be able to provide adequate amount of help to the patient in order to fight against their suffering. So, in earlier, as we have seen, the hospital mainly were staffed with the male nurses, but the female nurses also were in the practice of nursing. Generally, we will be seeing in previous years, the female nurses used to work in the home care setup where basically they will be having exposure to take care of the pregnant women or ladies in the home, as well as their delivery and the postpartum care. So majority of the female nurses were involved into the obstetrical part, or we can say they were involved in the caring of the pregnant woman and the delivery process and the care of the client in after the birth of the baby in the home care setup. Even the year of 1860s, or we can say till the year of 1860s, there was this particular term was into practice. Actually, there were no absolute formal education for the nurses till the year of 1860s. So from the year of 1860s, it has been considered that the period of educated nursing has begun. Basically, we are going to see the period of 1816, or from the year of 1816, when the Florence Nightingale School of Nursing is opened in St. Thomas Hospital in London. The complete practice or era of nursing has been changed with the formal education of them. So the development of the nursing during this period was strongly influenced by some factors. These factors include the trends which are definitely resulting because of the Second World War. The second one being an arousal of the social consciousness, the emancipation of the woman. And fourth one is definitely the increased educational opportunities for women as well as for the nurses. So this is the era where the nursing practice completely changed, because previously nurses would not get any formal education. They would just come into the clinical setup and they would just perform their skills in order to manage the client. There were no formal education or adequate knowledge to practice the nursing. From this year of 1860s, there was a huge change in the practice of the nursing, where the nurses started going under a formal education, where they started learning about the human body, their mind, the drugs and medicines, about their administration, about the side effects of the drugs. So definitely from there, the nurses would got the adequate information and knowledge to provide a heavy quality nursing care to manage the client in the clinical setup who are on need. Now, when we're discussing about the trends or changes in the nursing field that has been occurred since from many long years, definitely we cannot skip the discussion of Florence Nightingale. So here we are first going to read about some facts regarding the Florence Nightingale and how she have influenced the practice of nursing. So Florence Nightingale is considered as the mother of modern nursing. Till now, the Nurses' Day, that's the reason, are celebrated on the 12th May, because that is the day when Florence Nightingale has been born in the year of 1820 in Florence, Italy. Her education basically was rounded out by a continental tour, where she has been compiled the notes about her visits to different hospital setup, her observation of the sanitary facilities, social problems in different places she visited. Even she was involved in the taking care of the war victims, from where she got the idea of the nursing practice and the quality of the nurses. Florence Nightingale was also advocated for the care of those clients who were suffering from diseases due to lack of hygiene practices. So she have basically brought the changes into the nursing field, or we can say she have introduced the idea about the modern nurses. Now, with this idea of hers and with the it changes of day by day, the nurses or the field of nursing will be definitely now contain so many concepts. Now, the concept of the comprehensive nursing care in today's scenario involves managing the physiological responses of the client to the illness. The second factor is definitely is pain, which is now considered as the fifth vital signs of the client. Although it is a subjective matter, but the pain and management of it is very much essential because majority of the clients suffering from whatever disease will be primarily complained regarding pain. The next concept of comprehensive nursing care includes managing dyspnea or the breathing difficulty. The next concept is definitely managing the nutritional and hydration status of the client, which is very important because this is the major and basic part of our human physiology. The next concept is about the elimination. So it has been considered that a client should definitely be maintaining a proper bowel and bladder elimination to maintain their physiological process to continue. Next concept is the psychological illness, which is not always will be associated with the physiological or physical concept. We're going to see psychological illness is so much prominent in today's practice and where the clients definitely needs a continuous support in order to maintain a normal social and personal life. That's the reason psychological issues and management of it is a very important concept of the comprehensive nursing care now in today's scenario. The next concept being the social issues and its management. That's the reason I have mentioned that the nurses not only focuses on the individual, but also they will provide a comprehensive nursing care where they will be understanding the social resources and problems also of the patient so that the patient can cope up with the condition what he or she is going through in their society or in their living places. The next condition is the communication. Now, communication is considered one of the most important concept and part of the comprehensive nursing care. Communication to the patient, to the family member, and the communication to the other healthcare team member is a major responsibility of a nurses even in today's session. Last but the most important or one of the most important concept of nursing care or comprehensive nursing care is the spiritual care. So spiritual care not only helps an individual to boost their self-image, also it helps the person to have adequate amount of strength so that they can cope up with the changes that has been taken place due to the pathology which has been affecting the particular person. That's how we're going to see these are the basic concept of comprehensive nursing care, which even today are in practice in the clinical setup. Now here we are going to next learn about the trends in the nursing practice or nursing field now, which not only have influenced the nursing practice before, but it is considered that these trends of current scenario will be even influencing the nursing practice. So let us discuss now about the trends of nursing here. So the first trends in expanding knowledge and technology. So now if we say that the nurses are not only supposed to provide the bedside care to the client, right? They will be gaining the knowledge even about the pathology, about the disease processes, about the medicines, that is pharmacology, even about the normal physiology and anatomy of individual. Also, there is implementations of the technological skill for the nurses too. Nowadays, nurses are using higher technology to provide effective and quality nursing care in clinical setup. So expanding knowledge and technology, this particular trends definitely changing the nursing with the high pace. The second trends being the healthy people initiatives. Priorly or previously, we would have seen that nursing care are just only to focus to treat the ill client. But if we see in today's session, we are learning regarding the promotive health care, the preventive help in nursing care, curative and rehabilitative care, where basically we are trying to focus on healthy people. We are not only focusing on the curing the client's problem, but also we are trying to prevent it, and also we are trying to promote their health and well-being. That's the reason this particular trends, which is known as the Healthy People Initiative, also is changing the practice of nursing in a high pace. The third trend is evidence-based practice. Now, it is not only depends on the theoretical knowledge, but it does implements the evidence-based practice and their experience into the clinical setup. So where the nurses are will improving their implementation of the nursing care into the client, also the quality of the nursing care is improving because of the evidence based practice. The next trends of nursing field in today's scenario involves using standardized nursing care plans and terminologies. So we are going to read about the nursing process. So there you will be understanding that nowadays the nursing care is just not providing a care abruptly to the patient. It is a scientifically planned action of the nurses. So that's how now the nursing practice, even using certain standardized proper technique and terminologies in order to make a high standard and effective nursing care, and also helps the nurse to implement and plan the nursing care priorly and effectively in an individualized way, so that the nurse can focus on our individual patient and provide adequate nursing care to them to minimize their suffering. The next trend is the health informatics and nursing informatics. Health informatics and nursing informatics is very new trend in the practice, which definitely helping the whole medical professional to understand the concept. They will be also understanding the concept of how the clinical practice is changing, how it is affecting the people who are present with the illness, how the things are, or how medicines or nursing care is influencing the individual, what is the side effect or what is the after effect once the administration of the treatment has been done to a particular client. So that's the reason how the health informatics and nursing informatics, this recent trends of nursing, is creating a huge changes in the field of medicine and nursing. So as we have learned from the year of 1960s, there were just change, and we have seen what are the basic concept of comprehensive nursing care and what are the trends has been initiated from that era, and which has brought a complete changes of the nursing practice. Also, this particular trends and concept will be affecting, or we can say will be definitely improving the quality of nursing practice too in future. So we are going to read now about the evaluation of nursing, which has been taking place in worldwide from the year 1974. We are going to see here the standards of medical surgical nursing practice was published. It is written by a committee of the Division of Medical Surgical Nursing of the American Nurses Association. So basically, this particular written form of the committee also helps to improve the standard and maintain a standard of nursing worldwide, basically in the medical surgical nursing specialty. It involves the data collection from the patient. Also, it involves the formation of nursing diagnosis, set a goal of nursing treatment or expected outcome of the nursing treatment, prioritizing the need of the client and forming the interventions, as well as implementing those and evaluation of the client in against the response of the intervention. Basically, we have been seeing from 1974, this standardized practice has been came into the action where nurses follow a standardized protocol to form the nursing care plan. It is now a systematic and practical and technical way to recognize the need of the client and form a nursing care plan priorly as an individualized patient manner. Now, this particular practice not only have changed the nursing practice but also improved the quality and efficacy of nursing practice in clinical setup. Following that, a statement on the scope of medical surgical nursing practice has been introduced in the year of 1980s. In 1991, the Academy of Medical Surgical Nurses was formed to provide an independent specialty of professional organization for medical, surgical, and adult care nurses. In 1996, the Academy of Medical Surgical Nurses have published its own scope on standard of practice. In the second edition of this particular standard of practice and scope by Academy of Medical Surgical Nursing, documented and stated the implementation of the research activities into the nursing practice by the medical surgical nurses. So here in 2000, it has been instructed to the nurses that even the medical surgical nurses, while they're practicing, they should depend on the evidence-based practice, and also they should incorporate their knowledge of nursing research into the clinical practice. Now, nursing is called as the oldest of the art but youngest as a profession. It is called because it is considered that the nursing is the only one particular specialized field which has gone through many of the stages, and also it has been an integral part of the social movements and changes. Nursing is also considered, and it is considered that it is involved in the existing culture, shaped by the existing culture, but still it helps to develop the culture itself. So it's not only change the human individual or not only cure the human individual, but it also deals with a complete human being, which involve their physiology, their psychology, their social, and their cultural behavior. That's how, although nursing basically shaped with the present cultural beliefs and values and social practices, but not only the nursing, it depends on it, nursing also helps to improve or change the social practices, cultures, and beliefs. Now, according to World Health Organization, that is the WHO, they have been considering that the future prediction will be changing the social and human individual aspect of health and illness. So it has been noted that there will be certain changes will be taking place in the near future, which involves the major growth in the older population. Now, this consideration has been taken by the year of 2000. So, this basically includes all the expected changes that are going to affect the human individual's health and illness and disease process. That's the reason this particular prediction is a very important part that a nurse should know regarding, so that they can effectively act upon the social problems and also can act upon the disease process and the prevention within the society. Now, these changes are predicted, which are involved, as I have mentioned, the major growth of elderly population. The second changes that has been predicted by the WHO is declining of the birth rate majority in the Western countries. The third fact, which is being predicted by World Health Organization, is increase in chronic illness. The fourth one being mental health as a key issues. The fifth one being disruption of many of the infectious disease and eruption of many new infectious disease, even the increased prevalence of AIDS, that is acquired immunodeficiency syndrome. Now, as the prediction has been given by the year of 2000, depending on this prediction, definitely there are again some changes has been taken place into the nursing practice. Now, the recent trends of the nursing practice involves involve the education regarding the demography. Now, the changes in the demography also tend to influence the client's health and illness. That's the reason education regarding the demography now is considered one of the most important aspect of nursing practice and nursing training and education. So this is the basic trend now. The second one being the embracing about the technology. So nowadays in nursing practice, we are trying to use more and more advanced technology to provide adequate and quality nursing care. The third one being advancement into the communication education technology. That's the reason even the subjects or the theoretical subject has been introduced where the nurses would definitely be trained to improve their communication skills. Not only that, they should be in a position where they will be using their communication and technological skill in the nursing practice. The fourth trends being working with more educated consumers. The fifth one being increasing the complexity of the patient care. So it's not only providing a curative care as I have mentioned, but it is more than that now. So nursing practice now focus on promotive, preventive, curative and rehabilitative care. Not only that, nursing practice now is mainly based on individualized care and also it is an evidence based practice. Now, the next trends include increasing of the cost of healthcare and nursing basically trying to minimize the cost, making the healthcare as a cost effective part. The next one being adopting interdisciplinary skills by the nurses, and next trends advance in nursing practice, science and research. So due to these trends which are now in practice definitely has considered also or dependent also certain transition which is being taking place in the healthcare now. This transition also is affecting the nursing practices. So this transitions in the healthcare involves transition from curative towards the preventive approach. So as I have mentioned, the nursing practice in today's session is very much important, not only to provide the curative care to the client, but also to provide effective preventive care. The transition of the healthcare system, which is basically transferring from curative approach to the preventive approach, also has been influenced the nursing practice. The second trends or transition which is present in the healthcare system is converting or transition from a specialized care towards the primary health care. So this particular transition also has influenced the nurses or nursing practices. That's the reason, rather than the specialized care, now the nursing practice is also focusing on the primary health care in a home setup or community practice by the nurse. The third transition is from medical diagnosis to the patient emphasis. So even in nursing practice, we are not only focusing on the medical diagnosis, but we are trying to focus on the client's need. That's the reason in nowadays or in today's scenario, the nursing practice is individualized. Even the recent transition of the healthcare, which has changed the nursing practice completely, is the transition of the trial and error practice to the evidence-based practice. So as I have mentioned, the recent trends of nursing is basically focused on the evidence-based practice. Here, the nurses are not performing any trial and error method while providing any medical and nursing care to the patient, because you need to understand, when there is a practice that is depending on a trial and error method, that can be cause high risk and loss for the particular individual being who are seeking the medical treatment. That's the reason even in nursing nowadays, the evidence-based practice are being instructed. So which is not only helping the nurse to plan the care priorly and in an individualized way, but also improving the quality of nursing care and the health and well-being of the particular individual. The next transition which have affected the nursing practice is also involve the changes of the healthcare phenomena, which is focusedly on quality prior, which was priorly focused on quality only, but now it has been seen that the focus will be on cost effectiveness. That's the reason why in today's scenario, we are going to see ensured high quality nursing care with cost effectiveness. In the workplace, nursing practice also has been changed or transited to very way. We're going to see priorly the nursing practice, or it was only focused on the high technology, but now it is more humanistic in its approach or nature. Previously, it is considered within a healthcare setup, the nursing and other medical professionals and allied health science professionals was in a competitive approach to provide medical care. But now, in today's scenario, we're going to see the usage of cooperative approach among the healthcare team members. Now, even in nursing, priorly, we used to see the supervising or need of supervision was present, but in today's scenario, in nursing practice, we are using the coaching or mentoring approach while training the students or new nurses in the clinical aspect. Even in nursing, the decentralized approach is more preferable nowadays rather than going for a hierarchical approach. That's how the nursing is completely changing in today's scenario, even to improve its quality and also to ensure a high quality, effective nursing care for the client who are seeking the nursing and medical care in a clinical setup depending on their need. So recently, the nursing practice is not only focusing on the hospital environment, but also influencing or trying to improve the community environment. They're also ensuring the quality of nursing care not only as present as an excellence, but it is present to safeguard the human individual. So recently, we are seeing the increasing use of nursing case management into the practice, the expansion of advanced practice of nursing, development of clinical pathway by the nurses and improving the total quality of the nursing care, changes in the professional practice model, the trend towards increased acuity of the patient while present in a clinical setup or while seeking the medical treatment, which although have been begun in the year of 1980s, but now it has become the fact of life and practices. Now, in today's practice, we are not only seeing that the nurses are priorly or restrictively providing the care only to the medical field or to the medical setup or into the medical and surgical specialty, but we are also going to see that the registered nurses licensure are being provided in variety of specialty, right? We are going to see here the introduction of the licensing for addiction nurses who definitely fight against the people or fight against the condition of addiction in the society. Next, we are going to see the ambulatory nursing care or the ambulatory nurses are being introduced recently. Their rare specialization has been introduced into the nursing practice under the medical surgical nursing field, which includes the cardiovascular nurses, the critical care nurses, emergency nurses, dialysis nurses, first assistant nurses, holistic nurses, and home health nurses, even school nurses. We're gonna see the nursing practice where the nursing practitioners are also being introduced. So we're going to see the licensing is nowadays is very prominent for the acute care nursing practitioners, the adult care nursing practitioners, the family nursing practitioners, gerontological nursing practitioners, palliative nursing practitioners or palliative care nursing practitioners, even the pediatric nursing practitioners. Now this all field which comes under the nursing practice are more specialized skill or knowledge of body they're dealing with. So basically we are going to see here while the person or while a nurse is going through the nursing practitioner's course, it is providing a huge amount of knowledge about the nursing care and their role and responsibility. Even the psychiatry nurses nowadays has been introduced where the nurses are specializedly trained to take care of the patient who are psychologically ill. That's how now the nursing practice not only is focused on a particular specialty, but it have distincted different specialty where our nurses are learning regarding the core knowledge of the condition. They're understanding the clinical pathway, how the disease progression is occurring. They're understanding about the pathology, and now depending on the client's need, the nurses are nowadays learning to prioritize the need of the client and introduce the nursing care in the clinical practice. Now, nursing practice not only now restricted to the care of the individual, but it is more than that. That's the reason even we are going to see the advanced nursing administrator, clinical specialist, and clinical nurses leader also nowadays came into the clinical setup where they are practicing the nursing by using a broad body of knowledge, and they're basically improving the quality of the skill and knowledge of a particular nurse. So I hope till here you're completely understood about the history of nursing. You understood that the nursing is a basic concept which has been introduced to take care of the client in their need, but slowly and eventually, day by day, the nursing practice has been completely changed. And now it is not only a practice where we are providing the care to the individual, but it also includes providing promotive, preventive, curative, and rehabilitative nursing care to the patient to manage the client as a whole individual. That's the reason they're using the comprehensive nursing care to improve the life, the society, and ensuring a health and well-being. We have also read about cut. We've also read about the trends that has been changing the nursing professions, and also we have learned regarding few of the specialty where nowadays the nurses are able to get licensing and they are able to practice on their own. So I hope till here you have completely understood what is basically the medical surgical nursing and how it has been evaluated and changed since years. So thank you so much for attending the session. I hope you have enjoyed the session. So stay tuned for the next session where we will be further discussing regarding the concept of health, illness, and diseases. So we will be meeting you guys to the next session.